This question is actually from last night's panel that I didn't get to ask. My husband, who's going to be 80 in 2 months, smoked 2 packs a day from ages 13 to 33. The last 5 years, he's been a solid SOS-free vegan, no exceptions. We want to know about B12 because you mentioned a study that came out 3 months ago, but I didn't get what it was. Please.
Oh, Dr. Williams, you're muted.
Isn't that like a $10 fine? Sorry.
Something like that.
So yeah, I would have to run that through my search engine again to pull up the reference for you. I remember the facts, not the reference, but it's easily findable. It was and so my understanding of that when I read that paper is that if you were ever a smoker, that you never get, just so you know, for everybody, when you're stopping smoking, you actually decrease your cardiovascular event rate down to that of a non-smoker in about 3 years. It actually follows your fibrinogen level drop, okay? Your cancer risk never goes away, okay? Similarly, you can reduce your cancer risk by reducing the cigarettes, like 1 pack a day down to 1 cigarette a day. That's a 20-fold decrease in the risk of cancer. But that 1 cigarette a day would not reduce your cardiac event rate. So they're kind of very disparate. Okay, so I'm off on a little bit of tangent there, but just to say, with that background, your cancer risk never goes away. And it turns out that if you were a smoker, that the high dose B12, high meaning more than 55 micrograms per day, which is really so small, it's hard to do. How many do you need? You need about 8 micrograms per day. But more than 55 does actually seem to be associated, if not promoting, the incidence of lung cancer.
Thanks very much for that, Doctor. And up next, we're going to bring in Elaine. Welcome.
Hi, Dr. Williams. First, I just want to thank you for, I think you're the best doctor we've had in this 2 weeks. And Rush, you represent Rush so well. My cardiologist is Dr. Tochi at Rush.
Oh, wonderful.
And yeah, so I just think the world of that institution. I do have a question on ketogenic diet. I agree with you on all the aspects that you've talked about, but in the case of cancer, active cancer, is there room to discuss and consider a ketogenic approach in a short-term pulsed fashion for the sake of killing active cancer? And I'm asking that based on Dom D'Agostino's research on ketosis and hyperbaric chamber. He's a well-known researcher in that area.
So I would love to see outcomes on that. I can tell you that the basic science would go exactly opposite of that. I kind of thought you were going to go with the diabetes and the fact that that the weight goes down, the hemoglobin A1C goes down, the blood pressure goes down because the weight went down, that there are some benefits, but the fact of the matter is, this is really, the basic science says that animal protein actually increases cancer growth. And so referring to Dean, it may not be true of all cancers. You've seen the data from Dean Ornish about, stable prostate cancer, watchful waiting, eat plants, they do well, eat animals, they gradually increase. And then doing the in vitro part, meaning in a test tube or in a petri dish, where the serum of plant-based people inhibited growth and animal protein increased growth. I'm not an oncologist, but I certainly have had several cases, and I hate to talk about anecdotes, but there were people close to me where they were doing pretty well, they were stable, their scans looked good after chemo, radiation, therapy, and surgery, and they were doing pretty well, but they had gone plant-based and they were thin, and had an oncologist say, "You're too thin." Why? Not sure. And say, go ahead and eat animal products to try to gain weight and then see the cancer growth. Was that your comment that you?
I just saw that. Yep, that's from her. Yeah.
Yeah, I have nothing. So I still don't know the answer other than all of the stuff I just said is for everybody's information. I would say that I would not be surprised if if any kind of plant-based regimen inhibited the growth of cancer, because that's what the basic science says. All I know is the cardiovascular mortality stuff is very clear. That's the Seidelman article, Sarah Seidelman, that I mentioned earlier. Her publication said that if you do a keto diet with animals, it's an 18% increase in death. And if you do it with plants, it's an 18% decrease in death.
Got time for one more?
Please.
Appreciate it. Let's go to David R. Welcome, David.
Hi, thank you for the great presentation, Doctor. Because of a family history, I did 3 years ago a CAT scan, and I find out that my score was relatively high. I changed my lifestyle to be full vegan, and I would like to ask you, how would you recommend to test if my situation been improved or not? Would you recommend to do the CAT scan again, or because of radiation, are there any other type of test that you would recommend to test if my situation been improved by switching the lifestyle?
So you just happen to be talking about my favorite topic. Thank you very much. Gosh, and I only have 2 minutes left. I'd love to talk about this for a good 10 or 15. All right, so let's back up and clue everybody else in. When you say the CT scan, what you're really saying, I'm presuming, is a coronary calcium score, okay? And you don't have to tell me what the score is, but I want to tell you that we have specific guidelines. So first of all, the disclaimer is that just because your score is 0 doesn't mean that you're cardiac immortal, but it's darn good. And so if you happen to have a score of 0, the odds of you having a cardiac event in the next decade is actually extremely low. That's the MESA trial. They call it the power of 0. Now, if you're not one of those people that has a 0 because, like you said, your risk or your lifestyle beforehand, then you could end up with some calcium. We used to give everybody a statin and an aspirin. Nowadays, we realize that aspirin is actually dangerous. And that's why in our guidelines, hashtag rethink aspirin, we use it when people really need it. And so we draw a line in the sand at a score of 100. And some people on our committee were saying, well, maybe we should have drawn it at 300. So I won't ask you what your score is, but just remember what I'm saying. If it's above 300 for sure, and probably if it's more than 100, you need to take an aspirin or an aspirin substitute that, like clopidogrel, Plavix, seems to be taking over. Every study is saying, why are we doing this? Yeah, we've had aspirin for a long time, but clopidogrel is safer, it's no longer expensive. We shouldn't be putting up with all the GI bleeding and intracranial bleeding when we could just use Plavix or clopidogrel instead of aspirin. So you're probably going to see that over time switch. Okay, but that's only if you're in the hundreds. If you're between a score of 0 and 100, it's only a statin. And I always would recommend that you treat the coronary disease that's significant with my so-called SAVE program that I mentioned last night. SAVE, those 4 letters standing for a statin, antiplatelet drug, whatever it is, if it's indicated, a vegan diet, and an exercise program. Now, if you have a massive amount of coronary calcium, you then really should be finding out, like pitching in baseball or real estate, is location, location, location. If it's really up in the left main and it's or the top of the artery that goes down the front, those really need to be fully evaluated, more than likely with a stress test, to make sure it's safe to do that, the E part of SAVE. But I'll leave that up to you and your doctor to figure that one out. But what you're really asking is, how do you follow it? Well, hopefully what you're going to see is that the data is very clear that following it within 5 years is probably not something you should do if your score is above 100, because you're already not going to change your management. And statins increase your calcium score. How does that happen? It's healing of plaque. Statins heal plaque. They reduce heart attacks by getting the plaque, as does a plant-based diet, as does evolocumab. You have good data for each one of those therapies at lowering the amount of vulnerable plaque. That is the the high-fat plaque that's inflammatory, becomes hard as a rock and will never hurt you. And so you expect the calcium score to actually go up over time. And so the only time and this is something that we haven't dealt with in the guidelines. Well, wait a minute, it was 90 before and now it's 102. And now I'm going to go on aspirin when what really happened is that it healed. So why am I going on the aspirin? that's one of those questions that we just aren't able to answer yet, but we do know that the calcium score should go up with good therapy. Now, the bad news is if your cholesterol is out of control, your diabetes is out of control, you're eating animals all the time, and your blood pressure is out of control, your score will go up. But the score is going up because the disease is getting worse, not more stable, but disease is getting worse. And so how do you distinguish those two? You probably would need a CT angiogram. And I do want to address what you mentioned about radiation. The radiation burden is something that we're very sensitive to with CAT scanning in children and maybe young adults. But by the time you get to above age 40, it's the odds of you getting a malignancy from diagnostic testing is actually extremely, extremely low. And so we don't worry about it. I mean, there's extrapolations that if you did a nuclear stress test, which is a little more than a CAT scan in terms of radiation, every year for 40 years, you might catch up to the native amount of radiation burden in terms of inducing malignancies that you would get from the cosmic radiation of just walking in the sun. Okay. I know I've got to go, but there is someone asked what the A is in SAVE. It would be antiplatelet. It used to be aspirin, statin, aspirin, vegan diet, exercise. Not aspirin anymore necessarily. It's just antiplatelet drugs. Like aspirin, the substitutes seem to be better.